Good morning. This is Dr. Tariq. Today I am going to revise some practical exam questions. Let us start the practice exam. Number one is the internal visual examination of the stomach is known as what? The internal visual examination of the stomach is known as gastroscopy. A deep wound in the mucous membrane of the stomach is known as gastric ulcer. Ulcer is deep wound in the mucous membrane. 3. Infection of the stomach and intestine is gastroenteritis. 4. The backward flow of the stomach contents or gastric contents into the esophagus is known as gastroesophageal reflux disease. GERD, GERD, gastroesophageal reflux disease. 5. Internal visual examination of the colon is known as colonoscopy. Internal visual examination of the colon is known as colonoscopy. And the instrument that we use for colonoscopy is known as colonoscope. Scope is instrument, scope is visual examination. Number 6. Infection of the liver. Infection of the liver is known as hepatitis. 7. Stone in the gallbladder. Cholecystolith. Cholecyst is gallbladder and lith is stone. So stone in the gallbladder, cholecystolith. Condition of stone in the kidney. Nephrolithiasis. Nephr is kidney, lith is stone, isis is abnormal, is condition of. So condition of stone in the kidney is known as nephrolithiasis. Question 9. Name 3 layers those cover the brain and spinal cord. Dura mater, arachnoid matter and pia mater. Dura mater, arachnoid matter and pia mater. 10. Removal of the stone from the pelvis of the kidney. Pyelolithectomy. Pyle is pelvis of the kidney, lith is stone, ectomy means surgical removal. Pyelolithectomy is removal of the stone from the pelvis of the kidney. Question 11. Surgical removal of the gland. Lymph gland. Gland is adden, so lymph gland will be lymphaden. So lymphadenectomy. 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 Surgical removal of the lymph gland. 12. Death of the muscle of the heart. Myo is muscle, cardial is pertaining to heart, and infarction is death. So, death of the muscle of the heart. 13. Haziness of the lens of the eye is known as cataract. Cataract is when our lens of the eye becomes hazy and we cannot see. That is known as cataract. It becomes white. 14. Increase intraocular pressure of the eye is known as glaucoma. Increase intraocular pressure of the eye is known as glaucoma. Normally it is 12 to 21 mm of water. If it is more than 21, this causes severe pain and this is a surgical emergency, should be brought down within hours, otherwise can damage the retina forever and the person may become blind. 15. A tumor in the liver is known as hepatoma. Hepat is liver, oma is tumor. Hepatoma. So tumor in the liver. 16. Pain in the ear. Ear is oat, ot, and algia is pain. Otalgia. Otalgia. Next question 16. Internal visual examination of the eye. Ophthalmoscopy. Ophthalmoscopy. Internal visual examination of the eye. Ophthalmoscopy. Opthal means eye. Scopy means internal visual examination. 17. Cutting into the abdominal cavity. Laparotomy. Lapar is anterior abdominal wall or abdominal cavity. Antomy means to cutting into. Laparotomy, cutting into the abdominal cavity. 18. Abnormal condition of the gland. Adenosis. Adenos gland versus is abnormal condition. 19. Surgical removal of the lung. Pneumonectomy. Pneumon is lung and ectomy is surgical removal. Pneumonectomy. 20. Entering into the vein is known as phlebotomy. Phlebotomy. Entering into the vein to withdraw the blood. And the person who is trained for this job is known as phlebotomist. This is all about practice exam.